Demonstrating effective interpersonal communication skills. Effective communication. What is effective interpersonal communication? Interpersonal communication is the process by which people exchange information, feelings, and meaning through verbal and non-verbal messages. It is face-to-face communication. Interpersonal communication is not just about what is actually said, the language used, but how it is said and the non-verbal messages sent through tone of voice, facial expression, gestures, and body language. Goals of effective communication for health professionals. Effective teams are characterized by trust, respect, and collaboration. Increase audience knowledge and awareness of a health issue. Influence behaviours and attitudes towards a health issue. Demonstrate healthy practices. Demonstrate the benefits of behaviour changes to public health outcomes. Advocate a position on a health issue or policy. Increase demand or support for health service. Argue against misconceptions about health. Written communication is the ability to use the conventions of disciplinary disclosure to communicate effectively in writing with a range of audiences in a variety of modes, as context requires, using a number of different means to convey the message. What is effective written communication? First, it conveys a clear and unambiguous message to the reader, and second, it produces goodwill in that reader. To achieve these two objectives, the writer must write clearly, coherently, concisely, correctly, with courtesy and confidence. What is effective nonverbal communication? Interpersonal communication not only involves the explicit meaning of the words, the information or the message conveyed, but it also refers to the implicit messages, whether intentional or not, which are expressed through nonverbal behaviours. Nonverbal communications include facial expressions, the tone and pitch of the voice, gestures displayed through body language, and the physical distance between the communicators. These nonverbal signals can give clues and additional information and meaning over and above spoken verbal communication. So how does this impact professional therapeutic communication? The quality of communication and interactions between healthcare providers and patients has an important influence on patient outcomes. This influence can be pivotal in such areas as patient health, education, adherence, and satisfaction with care. As nurses have a key role in meeting the communication needs of patients, effective nursing communication skills are a critical element of patient care. To support the development of effective communication skills among nurses, a well-developed understanding of effective nurse-patient communication is required. What is a multidisciplinary team? Multidisciplinary care occurs when professionals from a range of disciplines with different but complementary skills, knowledge and experience work together to deliver comprehensive health care aimed at providing the best possible outcome for the physical and psychological needs of a patient and their carers. As patient needs may change with time, the composition of the team may also change to meet their needs. A strong culture of multidisciplinary care is seen as critical to improving the primary health care of Australia. How does a multidisciplinary team communicate? Understand the roles of the individuals within the multidisciplinary team. practice and promote respect, trust and inclusiveness between multidisciplinary care team members. Show respect for a patient's culture and values, and an awareness of how these impact on their therapeutic relationship within general practice multidisciplinary care. Respect the patient, informed consent and privacy when working with other members of a multidisciplinary team. Roles of individuals within a group. Group dynamics. Initiator, contributor. Purposes new or different ideas or approaches. Information seeker. Asks for facts or clarification. Opinion seeker. Asks for values and opinions. Elaborator. Provides examples. Orienteer. Attempts to summarize and keep the group focused on the task. Encourager. Offers praise and acceptance. Harmonizer. Mediates disagreements. Compromiser. Attempts to resolve conflicts. Negative group behaviours. Aggressor. Puts other people down. Blocker. Negative, stubborn and difficult. Dominator. Tries to take over the group. In conclusion, good communication between nurses and patients is essential for the successful outcome of individualised nursing care of each patient. To achieve this, however, the nurses must understand and help their patients, demonstrating courtesy, kindness and sincerity. Also, they should devote time to the patient to communicate with the necessary confidentiality and must not forget that this communication includes person who surround the sick person, which is why the language of the communication should be understood by all those involved in it. Good communication is also not only based on the physical abilities of the nurse, but also on education and experience. Therapeutic communication skills, the basis of better health outcomes.